Mr. Chairman. And thank you to all the witnesses for being here today. Ms. Deacon, this kickback shall not be considered as a kickback. I guess it depends on what the word is. Well, House Republicans have been working to lower health care costs for patients in their employer-sponsored plans, all while reducing unnecessary delays in care. One of these reforms is the Safe Step Act, which is led by our subcommittee chairman, Mr. Allen. Every patient is unique, which is why a physician spends time working through each patient's individual history to decide which treatment will be most effective. But insurances often require patients to try their preferred drugs first before moving on to what the physician initially wanted to prescribe. The intent here, ostensibly, is to prevent physicians from prescribing more expensive drugs when more affordable options are available. In practice, though, the health plans often steer patients to more expensive brand name drugs, even when generic or other options are available. And I believe it was you, Mr. Gelfand, who said, biosimilars for Humira acquired minimal market share despite being dramatically less expensive than named brand Humira. The current system, unfortunately, isn't designed around controlling costs for patients. It too often is designed to financially benefit everyone except the patient and the employer plan, in other words, to benefit middleman over the payer and over the patient. In the meantime, patients are exposed to preventable complications that require more visits to the doctor, emergency department visits, and even hospitalizations. Now, again, I understand the goal of step therapy if it's genuinely designed with the patient in mind, or even with some cost considerations injected, but that's often not the case. We sometimes see this when a patient has been on the same drug for years, shopped around for plans that cover the drug, only to find out after he or she switches plans that this drug will only be covered if they first fail other drugs. The even more concerning scenario is when the doctor knows the patient will experience problems with the insurer-preferred drug, but has to recommend that the patient risk it anyway before he or she can access the drug they truly need. Ms. Anderson, can you explain how step therapy protocols are designed and why they sometimes steer patients to expensive name brand drugs rather than alternatives?
Absolutely. And step therapy is something that, again, like you had mentioned in your remarks, it's something very benevolent. It's something that you say, okay, you know what, we want to make sure that we are doing cost containment. We're trying to manage costs for the health plans. We're trying to make sure everyone's premiums don't go up too much. But I think what's the challenge is...
And I would add, if I could just interrupt a second, and as a physician myself, there are, Me Too drugs. There are, several different statins, there are several different ACE inhibitors and so on. And, I know most of the two classes I mentioned are now all generic, but there was a day when there were, let's say 2 or 3 generic statins and 2 and 3 name brand statins. It only makes sense that you prescribe the more cost-effective drug first, because often it works, and that was my experience, certainly as a clinician. But proceed.
But and this is the case with many people who have rheumatoid arthritis, ulcerative colitis, Crohn's disease, is the drug that they're being asked to fail first on is not the drug that they have maybe heard and worked for them in the past.
Yes.
So a patient is going to have their insurance restart at the beginning of the year, and maybe they're going to have to restart for 6 months back on that drug that didn't work for them. And I think that is so heartbreaking for patients who they say, we can control our costs best, actually, more so than the health plan, more so than the PBM, and they can control it best. And, thanks to President Trump's reforms, many of the things between Trump RX and expansion of HSAs, that really gives patients more ability to control their health costs and their quality of care, because they're the ones having to go through all the step therapies.
Great. This probably is worth more than the 20 seconds we have. Mr. Gelfand, what should Congress consider doing to improve this situation?
I think that there are aspects of steps therapy that could certainly be reformed and modernized. For instance, It should all be electronic. It should all take place. You as a patient should be able to track through an online portal exactly where you are in there. But there are some serious problems with legislation that's currently being considered.
Thank you.